Reduce the amount of time you spend on your aligner simulations by ensuring you submit the records in the right way. The key step is really the online simulation and how you modify this. Many hours were wasted in not understanding how to communicate with the lab. So I wanted to discuss what the best way is to submit your first plan for any patient. So that's the first thing, is identify which teeth you don't want to move. And similarly, try to identify as well if there are any teeth on which you don't want to have any engagers or attachments placed. Be very, very specific in the type of movements you're prescribing and what you're trying to achieve. So be specific and say, simply align the teeth, resolve the crowding with IPR, but we accept that the overjet is going to be increased at the end of treatment. Similarly, when we're talking about overbite, we need to try and identify for the technician how we're going to correct this vertical relationship. By giving really specific instructions, the technician will know exactly what you're trying to achieve. Right now, we're just looking to finalize the tooth positions, and the treatment delivery will be considered in more detail in subsequent reviews of that simulation.